21st meeting of the Human Service Committee now comes to order. Madam Clerk, could you please call roll?
Ms. Andrews is excused. Dr. Carbone? Here. Chairman Colby?
Here.
Mr. Delahanty?
Here.
Mrs. Draw? Here. Ms. Cayley? Mr. Lightfoot? Dr. Quattro? Here. Mr. Terp?
Here. Is there anyone sign up for public forum?
Yes. When I call your name, please come forward to the podium. You will have 2 minutes in which to address the committee. Kindly conclude your remarks when the timer sounds. Thank you for your cooperation. Our first speaker is Peter Peters.
Thank you for the time to speak with you this evening. As you recall, I spoke before the full legislature last week. I am pleased to speak with the Human Services Committee and note the good work being done by Commissioner Kelly Reid and her staff for the care of the homeless. But despite these good efforts, there remain 50 or more people in our city who are chronically homeless. Many of these are the results of New York State's deinstitutionalizing people with mental illness. Many of these are results, no matter what their social challenges, each one is a human being. As a longtime resident of this county, I value the expressions of care we make for our fellow human beings, especially the least among us. And for this population I am speaking about now, I am deeply grateful for the generosity of those who are making an enlarged building available for the future care of the homeless. But as you know, that building will not be available until the coming spring. Rochester Emergency Action Committee for the Homeless is close to identifying a temporary shelter for this coming winter. May I suggest to you 3 levels of argument for the county's support of REACH's proposal. When I begin to think of moral reasons why we should be concerned about the 50 or so who will be without shelter this coming winter, I turn to my own faith tradition, that of a Christian. There I am told to love my neighbor as myself, sentiment shared by many faiths. And it turns out that my neighbor, as the parable of the Good Samaritan says, is anyone in need. People in need are not expected to qualify, just have obvious needs. I cannot stand by and do nothing in the face of our vicious winters and see my neighbors exposed to the possibilities of freezing to death. But there are more pragmatic reasons I would like to put to you. First, I imagine that there is an expense of the police and emergency personnel hours as they deal with homeless persons discovered on our streets. Second is the issue of our community's self-image. Do we want the papers recording the loss of life when no shelter is afforded? Third, when human beings are without shelter, they may be driven to some kind of criminal trespassing and once again call upon the time of law enforcement agencies. All of these reasons amount to a real cost to our city and county. These costs could be prevented by the provision of shelter. If moral or pragmatic reasons are not persuasive, how about civic reasons? Many of these chronically homeless people are veterans. At one time, they were healthy, productive citizens who served our nation in our armed forces, but who came home damaged. We cannot allow them to be neglected and left out in the cold when they risk their lives for us. REACH is a voluntary organization established to help coordinate the care of the homeless this coming winter. REACH is working to raise $50,000 in private funding. REACH will also coordinate the dozens of willing volunteers and the day-to-day operation of the shelter, but we cannot do this alone. As you're aware, REACH is asking for $50,000 from both the city and the county to help meet the challenge of the shelter this coming homeless winter. We need this money now, and ask that you authorize the President of the Legislature to authorize this money from the contingency fund. Time is of the essence. Winter is upon us.
Thank you. Next speaker.
Our next speaker is Kelly Finnegan.
It's never a good idea to follow Dr. Peters because he's such a good speaker. I'm going to try to do it. My name is Kelly Finnegan. I'm a social worker at the House of Mercy. I'm a member of REACH. I was also the director of Sanctuary Village, which was a temporary shelter that we opened up this past winter through the generosity of Ken Glazer at Buckingham Properties. I brought copies of a proposal that we've created for this temporary shelter that we're going to open this winter. So you all get a copy of it. I can also send electronic copies if that's easier. And you'll be able to read it and get an idea of what we're trying to do. It includes a summary of what we're doing. I talk a little bit about the history of how we got here. I just wanted to focus quickly on the need. It's been documented we don't have enough shelter beds in homeless shelters for people. This is exacerbated in the winter. In the summertime, a lot of people live outdoors, and they choose to do that. In the winter, they don't have that option. There was a recent point-in-time study this past summer done by the county that found approximately 90 people living on the streets. A lot of people estimate it's more like 200 that live countywide on the streets. Either they don't live in a shelter or anywhere else. We've come up with the number of 50 people that we're trying to shelter this winter. We get that number based on our busiest night at Sanctuary Village last winter was 75 people that we had in the loading dock. We're calling on other shelters to expand their capacity to take in 25 people, and then we're going to shelter 50 people. We've formed REACH, the Rochester Emergency Action Committee for the Homeless, to do this. It's going to be an independent body. We have established a relationship with Canandaigua National Bank, who will hold a bank account for us and will take in all of our donations. We've created an advisory board that will oversee those donations. So, you know, I guess if anybody has any questions after reading our proposal, we invite you to ask us. I think I'll just end by pointing out, you know, why we need to do this. We'll get fewer people off the streets. It will reduce the chance of someone dying on the streets during the cold winter. It'll make services more readily available to people. It'll be positive for government and elected officials. And also, it's something we can do. To be honest, we don't have the homeless problem that other cities have and other counties have across the country. And so if we can come together, and we have people in the private sector, many of them here today, who are willing to step up and do it. I think we can have a public and private coalition and get this done, and to be honest, could be a beacon of hope throughout the country of how we can handle this difficult situation. All right, thank you.
Our final speaker is Richard Rosen.
Hi. I've been the volunteer president of Tempro at Temple Brith Kodesh in Brighton for 25 years. We own 11 houses that the county leases for use as emergency shelter for families. And this program of ours has been administered by the Department of Human Services for 45 years now. So we've housed thousands of families. You heard Pastor Peters explain what's needed to keep homeless singles warm and out of the freezing snow this winter. Running a parallel program, Tempro staff has gotten to know the players that can get the proposed temporary emergency shelter up and running. I'm very impressed with those who've stepped up to make this happen. Kelly Finnegan from the House of Mercy, who you heard, Nick Culture, who was the outreach person from the County Office of Mental Health for many years, and Becky Migliorati in Kelly Reed's office. A large number of experienced volunteers have also stepped up. They worked last year. We saw what they do. We were able to evaluate their work. I'm convinced that the program outlined for this winter of 2016 will be well administered and accomplish its goal. The 1/3 of the cost that's being asked of the county, about $50,000, is needed to pay for utilities, supervision, and a big bill for security. This county's done an outstanding job keeping the homeless safely off the streets. But there'll be an embarrassing gap this winter if we don't fund this emergency effort. I urge that you allocate the funds from the contingency fund in time for December's cold weather. Thank you.
Thank you, sir.
This concludes the public forum.
Is there anyone present who has not signed up to speak that would like to address the committee at this time? The next item on our agenda is approval of minutes. You have the September 29th minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 15-0308.
Moved by Legislator Carbone, second by Legislator Delahanty. Any discussion? Legislator Keeley.
Thank you very much, Thank you very much.
Thank you.
Thank you very much. Through you to the administration, were there any respondents to this RFP that were local? Thank you. And just off that, through the chair, have we had local respondents to this in the past?
Through the chair, not to my knowledge during the last RFP.
All right, thank you. If I could ask briefly, in this particular type of question, analysis, data collection through the chair, is this samples coming through the city, are these those samples that are taken through landlord inspections?
Through the chair, these are samples that are taken as part of the county's commitment to reducing lead poisoning amongst children in various different home environments. And so those are done through that inspection process, yes.
Right, I understand that. That's not exactly what I was asking, since we have multiple ways of testing lead levels in the city through the chair. These are inspected at City of Rochester homes, and are they through any particular program? In other words, you get a list of properties from the city that need to be inspected, and I guess I'm looking at what the overreaching program for that is, that you get those listings to inspect.
Through the chair, this is done through the lead poisoning prevention program, which is led through the Monroe County Department of Public Health with strong collaborations from our various community partners, including the City of Rochester.
All right, thank you. I'm not going to pursue it any farther. I'll let it go, and I don't have any problems, so thanks.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item, please.
Referral 15-0310. Amendment.
Moved by Legislator Delahanty, second by Legislator Draw. Any questions? Legislator Keeley.
Thank you very much. Got that one out right. Through you, Mr. Chair, to the administration, can you tell me approximately how long the two full-time positions have been open?
Through the chair, the two positions that are currently open have been in excess of 18 months, I believe.
And through the chair, can you speculate as to why it's so difficult to find someone full-time for these positions?
Through the chair, there is a national shortage of forensic pathologists. So Monroe County, despite its wonderful attributes, is competing with a very, very small pool nationally.
Thank you. That does it. And then, would you estimate that, since these are temporary through the chair, in essence, temporary contracts with people coming in at different periods of time, is this a more costly way to do things than if we had a permanent person, two people?
Through the chair, it certainly could be more, certainly would be more cost effective if we had our own full-time staff, and we have been aggressively pursuing various different opportunities to ensure that as a long-term solution. Right now we have a short-term need, which is therefore this request.
All right, thank you. And then just for my own knowledge through the chair, do you anticipate that of this list of individuals, that at any given time we'll have one that's doing work for Monroe County? In other words, say one for 3 months and then another one would be tabbed? Or might there be a 2 to 3 or month period where we might not have?
Through the chair, this per diem work is generally done in 1 week increments. That's kind of the industry standard, and
Okay.
so they will come and work for 1 week on average. We have generally just a few from that list that we've been utilizing regularly to fulfill that need, given their familiarity with our processes here in the county.
Thank you. But then, to that, since I misunderstood the length of time, would there be a week where we wouldn't have one of these extra persons taking up the slack? In other
Through the
words?
chair, that is correct.
Okay.
We are utilizing this per diem staff to assist with the caseload managed by the ME's office.
All right, thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Are there any other matters to come before this committee? Less listed.
Should have said, can we hold this open for Mr.
Yes, we
Lightfoot?
can.
Thank you.
There are no other matters to come before the October 21st meeting of the Human Service Committee will remain open until the end of the business day for legislator Lightfoot to register his vote. The next Human Service Committee meeting will be November 17th at 5:30.